Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert, and media medical expert. I help you feel, look, and perform your best regardless of age or injury. That's right, it is the one time, the one place that I answer medical questions. Now, I don't give medical advice. I can't do that online, but I'm giving you information about orthopedic injuries, surgeries, rehab, recovery, so that hopefully you can make the decision that's best for you. You can talk to your doctor about it. You can understand what your doctor's talking about based on some of the information that I give you in response to your question. I hope you're having a fantastic week as we end the month of March. Very, very excited to be here. I hope you are enjoying. I've gotten fairly heavily involved in both long-form videos on YouTube and other social media, as well as shorts on TikTok, Instagram, and YouTube Shorts. And so far, that's going pretty well. I hope you're enjoying those. I've sort of gone back to really focusing mostly on orthopedics. I still occasionally will do overall health, wellness, exercise, that kind of thing. All right, so if you have any questions, ask, or this is going to be really short. I am studying for my recertification in orthopedic surgery and sports medicine. Not so much studying, but doing this thing you have to do every year for 5 years. I am trying to do that today and Tuesday. So if we have no questions, I will make this very, very short. Heading into the next few months, I should be here most every Friday, barring at least one in May, I guess, and maybe one in April, but that is where we are. All right. A frequent contributor, Jagadish, will the biodegradable screw ACL dissolve inside? How long will it take? Yes, they typically dissolve How long has been debated. It depends a little bit on what the material is. Not all biodegradable screws are made out of the same material, but typically it's a long process. When I used to go in for, I didn't use bioabsorbable screws usually, I used metal screws, but when I would go in to revise other people's ACLs that failed or scoped them for a meniscus tear, they had a prior ACL reconstruction, they were almost always still visible, maybe partly disintegrated, and that would be a year or 2 years later. So even though they say anywhere from 6 months to a year, it's probably longer than that, but again, that depends on what type of material. Having said that, one of the advantages of them are if you need a revision surgery, you don't have to worry about having to take the metal out, because you could drill right through them if you had to, what was left of it. So there are some potential advantages to them. Any side effect with them? No. Typically, there's not thought to be any side effects. All right, Mary, concerned about getting a hip replacement at the age of 77. So it's interesting. One of the reasons, and I'm going to give a long discussion of this, or sort of long for me, part of the reason I pivoted to regenerative orthopedics, what I call anti-aging orthopedics, using regenerative procedures, peptides, medications that might be considered off-label or experimental by the FDA, procedures, like exosomes and a number of other things, is because I try to help people avoid joint replacement. It's not to say that people can't have good results. If you look at the studies on hip and knee replacement, generally they do well. 70 to 80% of people, the knee replacements where there's more data, 70 to 80% of patients are generally satisfied with their outcomes, but that's still 20 to 30% that are dissatisfied. If you do the math with just knee replacements, 850,000 a year done in the United States, that's somewhere between 170,000 and 255,000 patients a year who are dissatisfied with their outcomes of their knee replacements. I talked to a patient yesterday, and he had several friends that had knee replacements. All of them apparently were unhappy with their outcomes of knee replacements. Now, at least with knee replacements, and I suspect this is true with hip replacements, the older you are, the better the outcomes. That's definitely been shown with knee replacements. People in their 80s are most satisfied with their outcomes, and each decade of life, that satisfaction level drops, meaning the younger you are when you get them, the less likely you are to be satisfied with how you are. And that's largely due to people not being able to do what they want to do. Now, one of the other factors where age plays a role in joint replacement is how long that joint replacement, how long those components last, the metal and plastic. And typically, I know that joint replacement surgeons will give patients 20 and 25-year survivorship data. I expect the more realistic expectation, you may do better than this, but is to expect 15 years out of it. So if you're 77, that gets you to 92, if I'm doing my math correctly. Good chance that patients don't last till 92. If you just look at average age of death, men and women, that's typically earlier than 92. So that, the reason it matters is you really don't want a revision joint replacement. You have to take out the metal and plastic. It takes out a lot of the bone that it's now stuck to. It's a monster operation, much bigger than a primary. The results are not nearly as good. So you would like to wait long enough for your joint replacement so that you don't need a revision. If you're, like my patient yesterday, 51, who's been told by 2 orthopedic surgeons that he needs a knee replacement, he will almost certainly outlive that. And then you're talking about needing that revision and maybe a second revision after that. And again, that's assuming it all goes well. So that is why I largely do what I do. There's other reasons, trying to help people avoid getting addicted to narcotics, which is unfortunately common in orthopedic surgeries, especially with joint replacements. Having said that, it can be a good operation for many people now that I've scared Mary away from it. But that's why I do what I do. I will tell you, if you talk to the joint replacement surgeons, they say what I do is, unfounded by science, not true, but that's what they say. And they don't typically tell you about the dissatisfaction rates. I know a lot of joint replacement surgeons personally, and I know their patients, and I know that discussion never comes up. They talk about very, very small risk of blood clots and infections and things like that. They don't talk about 20 to 30% of people at a year are not happy with how they're doing, and that I feel like is a number that people need to know. Is there a concern with tissue acceptance with a joint replacement? Sorry, I can't get your comment on the screen, Mary. There it is, tissue acceptance. Generally, no. They are typically well accepted. Now, it depends on what you mean by accepted. They can get loose, and that's certainly a thing, but that is not a common thing initially. That typically happens for a variety of factors over time. Yeah, and that's typically what people do. When the pain gets to the point you can't stand it, have it done. One of the nice things that in my world, I see more people with knee arthritis than hip arthritis, but you can get a lot of the treatments we do into the hip without that much difficulty. It's just, knees are very easy to inject. You just have the patient sit off the end of the table and you inject it. But it can be done with the hip through different measures. Rudresh, I hope I'm saying that right, had ORIF of the left ankle, lateral malleolus. 9 weeks, still gap showing in the x-rays. Is it healing correctly? Well, I don't know because I can't see your x-rays and I wouldn't be able to give you advice anyway. Having said that, bone typically takes time to heal before you even see it on x-ray. So the fact that it isn't completely solid at 9 weeks, I wouldn't worry personally about an x-ray until at least 3 to 4 months, because there's usually more healing actually there if you were to open up the wound and look at the bone than what an x-ray shows. So that to me wouldn't be very concerning. I don't know if that's necessarily in your case. Typically, if the fracture was well aligned, held in place with plate and screws, that should be okay. That surgery has a very high healing rate. So I don't expect that I'd be fairly concerned, but again, I can't see your x-rays, and even if I did see your x-rays, I wouldn't be allowed to give you an opinion on it. But having said that, typically that wouldn't be terribly concerning. All right, I'm not going to give an idea of how to pronounce that. I apologize. It just comes up as Q in the little thing on the side. Good evening, doctor. ACL surgery a month ago, swelling until now. No, that is a pretty normal thing. I mean, ideally, the faster you get the swelling down after any knee surgery, the better, because a big swollen knee, what's called an effusion, has a reflex inhibition on your quad function, and it makes quad strength slow to come back. Lifting your leg off the couch or off the bed or off a table is hard, and obviously that makes walking hard. If you don't have quad strength, it makes walking normally hard. So you want to get that swelling down. Plus, I'm sorry, before I get into the why you want to get down, the other reason is swollen knee hurts, and so the quicker you get rid of that, the better. Ideally, you'd like it down by about 2 weeks, but it's not uncommon around 4 weeks. That's a fairly invasive surgery. A lot of that is blood that just takes time to resorb, so that's not terribly surprising. All right, looks like all the questions. Thank you so much for joining. As always, as I've said for the last 3 or 4 times I've done this show, we are still looking for 5 patients with knee pain, but it can be shoulder pain, hip pain, whatever joint pain it is, that want to get significantly better in 30 days without cortisone, without surgery. Definitely touch base with me. In the description below this video is a link to my website. Fill out that contact form. In the description, type the word interested. My assistant and I will get back to you and give you more information. I hope you're having a one last question. And 33 definitely understand the fear of a hip replacement. I hope you all, wherever you are, I hope you have a fantastic weekend, a fantastic start to the month of April, and I look forward to seeing you most each and every Friday right back here for Ask Dr. Geier Live. Have a fantastic weekend.